Good afternoon from Brussels. My name is Eduardo Pisani. I'm an advisor to Evoke Incisive Health, and I would like to welcome everyone and thank you all for your participation to this event today that will focus on addressing PNH unmet needs, and will also discuss and define a policy roadmap to improve quality of life and the care of PNH patients. PNH is the acronym for paroxysmal nocturnal hemoglobinuria, which is an ultra-rare disease, chronic and potentially life-threatening rare disease of the blood. At a time when there is significant global political momentum on rare diseases, it is all the more important to raise awareness and inform the public policy debate about the challenges which are facing PNH patients and offer solutions through an initiative which is both a platform for discussion known as Partnering for PNH, which will be obviously better illustrated in a few minutes, as well as the definition of a global policy consensus paper. I would like also to convey our special gratitude to members of the European Parliament, Mr. István Ujhelyi and Mr. Stelios Kympouropoulos, who are committed to supporting rare disease patients and are particularly committed to support this platform for the PNH community. When it comes to the program today, you will see that the agenda is very straightforward. Beside some introductory remarks from MEP Ujhelyi, we will have approximately 50 minutes of a moderated discussion, thanks to the presence of experts from different parts of the world who represent different stakeholder groups. And these 50 minutes will be followed by a Q&A session of approximately 20 minutes. And finally, we will conclude with remarks by MEP Stelios Kympouropoulos. Few housekeeping rules. Perhaps we can even show them on the screen. All the participants are going to be muted throughout the event. At the same time, it is possible to receive a translation in French and Spanish by clicking on the appropriate button. And for all questions, please use the Q&A button, which is also visible at the bottom of your screen. A final point, a final initial remark is that the debate will focus on policy issues and not on commercial aspects related to the PNH treatments. Therefore, now we are getting close to the beginning of the discussion, but first I would like to give the floor to Mihaela Veringa, who represents Sobi, a European research-based biopharmaceutical company which is dedicated to PNH patients and rare diseases, and which is also supporting this initiative. Mihaela, the floor is yours.
Thank you very much, Eduardo, and thank you everyone for joining us today for the launch of Partnering for PNH. My name is Mihaela Veringa, and I'm a director with the Patient Access and Policy team at Sobi, and I have been responsible for this project. In the public debate, the needs of people living with a rare disease are often overlooked, and this group and this initiative aims to put the needs of people living with PNH back on the map. The group has worked a lot to develop this global policy consensus paper, and they will present the key outcomes today. We are embarking on a new journey for people living with PNH towards improving the quality of life. And please consider this launch event as an invitation to join us in this new journey and partner with us to deliver impactful results for people living with PNH and their caregivers. Once again, thank you very much for joining us. We very much look forward to a good discussion. And with that, I look forward to the next presentations. Thank you.
Thank you, Michaela. And a special welcome now to MEP István Ujhelyi, who is with us and who will give some introductory remarks. Again, Mr. Ujhelyi, on behalf of the PNH community and on behalf of this group, thank you very much for your presence, your time, and your commitment to the PNH community. The floor is yours.
Thank you, Eduardo. Thank you, Michaela. Dear ladies and gentlemen, no, this is my honor to be here because I'm not professional. I'm only a politician. And I made a decision to serve the European health issues because I arrived from Hungary and my parents were doctors, medical doctors. So all my life, I was very close to the medical issues. But in Hungary, as a politician, I learned that we have to do something. So my name is István Ujhelyi, and I really very pleased to be here with you today as member of the European Parliament and as the political co-chair of the Partnering for PNH. And I'm also one of the initiators of the European Health Union program and so-called champion of the European Health Union movement. I understand that more than 60 people have registered, which is great because this event was created to spotlight a rare blood disease called PNH and pledge our support for people living with it. I'm really proud to be co-chairing this multi-stakeholder global initiative with European, Australian, Canadian representatives and to contribute to making a positive impact for people living with PNH. I really appreciate the opportunity to learn and understand more about this condition, its impact on patients, their caregivers, and our healthcare systems. Zoltán Ponta, who is my excellent advisor in the European Parliament, is also together with us. And I hope, we are a good couple. I speak and he will write everything and to memorize all your opinions, what we have to learn and we have to serve in the European Parliament. Partnering for PNH has created a unique platform, I think, to spotlight the unmet medical needs of people living with this disease. The expert group has proposed several policy recommendations to drive change at global and national level to gradually improve the lives of people living with the PNH. Indeed, the global policy consensus paper drafted by the Partnering for PNH expert group highlights the many gaps and challenges that exist today when it comes to accessing care and adequate treatments. We know these issues to be similar across many other rare diseases, such as improving delay time to diagnosis, lack of expertise and awareness of the disease, poor quality of life, and so on. The expert group will talk about these gaps and challenges in more detail during today's event and hopefully give all participants the impulse to further collaborate and push for change in their respective countries. Our role as policymakers is not only to raise awareness and support initiatives like this one, but also to inspire continuous action at European level and across the world. And I'm happy to work with you on this. At the European level, the time is right for such action to make a long-term impact with important legislations currently undergoing review. If done right, this could have a transformative impact on the lives of rare disease patients, their families, and on healthcare systems for years to come. It is essential that we create a rare disease ecosystem that enables investment in research and continuous innovation for the next 20 years. And in this field, particularly member states need to cooperate more closely and as early as possible with all relevant stakeholders to make sure that the needs of patients are taken into account. I believe Europe can and should do more for rare diseases patients. And I will pursue this endeavor with my European colleagues, of course. And last but not least, I would like to thank personally to Juliet and also to Mihaela for the excellent work and cooperation. So thank you so much for your invitation. I'm ready to learn and serve you. Thank you so much.
Thank you very much indeed for your kind words, István, Ujhelyi. This is certainly very appreciated, and I am sure, we are all sure, that there will be significant work to be done at the European Parliament, and that your commitment and also your passion for health policy with a focus on rare disease policies will be fundamental to carry forward the voice and the objectives also of the PNH community.
Eduardo, only one more thing. I really need your help, not only to teach us, but also we have to organize a stronger lobby for all the European public health issues. That's why I need you personally, you and the others who are here, and also the organization, because if we alone, some colleagues in the European Parliament, is not enough to make the noise in the European bubble. So that's why I really need you to make actions. So thank you so much again. Thank you, Eduardo.
Köszönöm szépen. And,
wow.
Yeah, nagymamam magyarul. That's the only thing I can say in Hungarian, and I am obviously your humble servant, but my grandmother was Hungarian. So it's a double pleasure to help. I would like to move now to the moderated session. Obviously, there is a lot to say, and we have a stellar panel of experts from different parts of the world, not only Europe, but also Canada and Australia. Michael in Australia probably hates us because of the time that he's obliged to be, on camera. But nevertheless, thank you all very, very much indeed for taking the time and participate in this discussion. I will introduce everyone as the agenda proceeds. And clearly everyone from a different perspective. We have got healthcare professionals, patient advocates, and representatives, a representative of the biopharmaceutical industry. They will all deep dive into some of the challenges and the solutions which can be identified for the PNH community, and which are captured in the global policy consensus paper, which is being developed and will be refined thanks to the platform which has been described already, Partnering for PNH, and obviously the input and insights of all the participants to this event. Now, let me turn first to Dr. Morag Griffin, who is an hematologist and a PNH specialist at Leeds Teaching Hospital in the UK, who will focus on the need to raise awareness on PNH and to expedite access to treatment. Morag, can you give us also a brief illustration of what PNH is, what causes it, and what would need to change in order to improve the lives of people living with PNH.
Yes, of course. Thank you, Eduardo, and I'm delighted to be presenting at this launch event today, and look to plan some future work with the MEP team as well. And so it's really exciting. So moving on to the next slide. So to provide a bit of background on PNH, it is a rare disorder, a very rare disorder, with a global incidence estimated to be around 1.3 per million of the population, with a prevalence of around 16 per million of the population. Research over the last couple of decades, both in basic science and in treatment development for patients, has significantly increased. But like all rare diseases, there's often a lack of awareness of the disease, and this is one of the aims of this launch. Patients can often have a prolonged treatment journey to diagnosis. They can often present to different specialties depending on their symptoms, which I will discuss in a couple of slides' time. And an early diagnosis can significantly improve patient outcomes, reduce comorbidity, and reduce the financial and emotional impact on patient well-being, and also sustainability of healthcare systems. It's not uncommon for patients to have presented to 3 or 4 different specialties before they're diagnosed with PNH. Next slide, please. So what is PNH? PNH is an acquired disorder of the bone marrow. It's not inherited, and it's caused by a mutation in the PIGA gene within the stem cells in the bone marrow. The stem cells go on to produce PNH red blood cells, PNH white blood cells, and PNH platelets. So what does the PIGA gene do? Normally, in normal cells, it will code for something called a GPI anchor, which will anchor proteins onto the surface of the cells, which creates a protection around the cells so that they can go about doing their normal day-to-day activities. For red blood cells carry oxygen, white blood cells fight infection, and platelets help your blood clot. If there is a PIGA mutation, the protective proteins can't be anchored to the cell surface. So therefore, the PNH cells are produced, they do work, but they are very vulnerable to being broken down. The amount of PNH cells that you produce depends on the activity of your PNH stem cells, and so patients can have any level of PNH ranging from 1% up to 100%, and that depends on the level of the PNH, depends on the variability of patient symptoms as well. Without the protective proteins on the surface, the red blood cells are susceptible to destruction within the circulation by complement. This process is called intravascular hemolysis. This leads to a variety of symptoms. And one of the main overwhelming symptoms that patients experience is fatigue. And as you can see, this is around 96% of patients will complain of fatigue, and this is significant fatigue. Patients aren't able to participate in weekend activities. They go to work and they come home and they go to bed at 7 o'clock in the evening. And I think this emphasizes the importance of taking really detailed history from patients and actually drilling down into their symptoms. A high proportion of patients are anemic, which again affects their fatigue. And around 25% of patients have hemoglobinuria, which is red or black urine. And you can see why patients may well present to the urology team within this situation. Smooth muscle relaxation does not occur with PNH, so therefore patients complain of abdominal pain. Again, you might present to the gastroenterologist, erectile dysfunction, difficulty swallowing or dysphagia, and shortness of breath. As haematologists and as clinicians, we particularly worry about the risk of thrombosis, which I will discuss on my next slide. But patients find work and family life very difficult due to the variety of symptoms, and with the often delay in diagnosis of PNH, this can be a very stressful and difficult time for people. Life-threatening complications, I've already mentioned thrombosis, and in countries where treatment is not available, and in countries where treatment, prior to treatment being available, patients presenting with PNH and thrombosis had a significant impact on their potential survival, but also on their comorbidities. And this can be venous and arterial thrombosis. And I always say you have to have a diagnosis of PNH to be treated for PNH. And so patients with thrombosis presenting with a DVT, deep vein thrombosis, may well not be diagnosed with PNH. And so there are various initiatives to try and increase awareness as well around issues with thrombosis. Cardiovascular disease is also a prominent issue, in particular patients having cardiac events. We spend quite a lot of time talking to cardiology teams as well. Chronic renal failure and pulmonary hypertension are also complications which are associated with PNH. But I'm very pleased to say that particularly in countries where treatment is available, we see much fewer of these life-threatening complications once patients are diagnosed, and they have now patients on treatment have a normal life expectancy comparable to that of the general population. And therefore, as a community, we have two areas to address. One is for patients who have access to treatment, addressing unmet needs in PNH, having managed the life-threatening complications, although I go back to my earlier comment that you have to have a diagnosis of PNH before you can address these. We can address treatment options, and we're not going into specifics today, but there are now available options including intravenous, oral and subcutaneous. We can address unmet needs of hemoglobin levels, and in particular extravascular hemolysis, which I've only been given 10 minutes, so I can't go into extravascular hemolysis today, but it may well come up in some of the later discussions. And we always aim to throw out there a cure for PNH, because PNH, treated and untreated, is a chronic condition which patients learn to live with, but you always aspire to a cure for any disease. And next slide, and that leads me into the policy recommendations of the continued awareness of PNH, and trying to increase awareness among healthcare practitioners, not just haematologists, but other healthcare practitioners that patients may well present to. I've already mentioned the urologist or the gastroenterologist, and general practitioners, as well as policy and decision makers to uplift the awareness on a wider scale as well. Centralised disease registries are already available, and we would encourage physician and patient involvement within these so that we can continue to promote PNH and the learning within the field. And I go back to my earlier comment, which I've alluded to several times, and there are significant inequalities within the PNH field for patients, but this also occurs within rare diseases as well, which was also discussed earlier, that access to treatments and even diagnostic ability in some countries is very limited. And as a healthcare community, we have a moral duty really to try and improve outcomes of patients across the globe, not just in countries where treatment is available. Clinical guidelines and indications for treatment are on a long list of objectives, particularly for the International PNH Interest Group, and there is a meeting planned in the second quarter of next year to try and address some of these. So I thank you for your time, and I look forward to the subsequent discussions and lectures that are planned in this session. Thank you very much.
Thank you very much indeed, Dr. Griffin. Thank you for illustrating what PNH is and what are the challenges that PNH patients are facing. A quick question to you regarding the global number of people having PNH, which seems unclear to date. Do you believe that as PNH awareness increases, we will get more clarity on what the global prevalence is?
I think that's a very good question, and I think we do underestimate the prevalence of PNH, and you have to be presented to a physician that's got awareness of PNH before you can be diagnosed with PNH. So it will always remain a rare disease, but there will be some patients that never get diagnosed who have a catastrophic thrombosis or something. And so I think the incidence and prevalence will increase, but we need to increase awareness and then collect the information.
Very clear. Thank you very much again, Dr. Griffin. And now let me invite the patient voice. We have Barry Katsof, who is the president and founder of the Canadian Association of PNH Patients, and Cindy Anthony, who is the executive director of the Aplastic, Anemia and Myelodysplasia Association of Canada. Welcome, Barry and Cindy. And your focus will be on the role of patient organizations in order to improve PNH quality of life, and also focusing on the importance to empower patients and their caregivers in decision-making. Barry and Cindy, the floor is yours.
Thank you. Can I see the first slide? The patient, well, first of all, I come to you as a patient, so I'm speaking to you from experience. As was just mentioned, the patient journey is not quick. It's typically 2 to 5 years, depending on the caregivers that a patient is seeing. As mentioned, patients typically show issues, difficulty swallowing, shortness of breath, stomach pain. These are all symptoms that are prevalent in other diseases. So it's rare that a healthcare practitioner at first zeroes in on PNH. You start going to different doctors because of stomach pain, shortness of breath, and so on. One of the overt symptoms is dark urine. And typically when you see a doctor because of that issue, they go the urology route. So you're spending time and energy doing all these different screenings and tests that don't necessarily lead to PNH. You really have to be lucky that somewhere along the line, patients or the healthcare practitioner takes a blood test and they recognize the markers of high LDH, high bilirubin, and so on. So this whole journey from start to finish could take, in my case, 2 years, and in a lot of cases, 3+ years. Then you get the diagnosis. Is that good news or bad news? Next slide, please. You ask yourself, well, first of all, when you get the diagnosis, in today's day and age, you run home and you sit in front of a computer and you have a chat with Dr. Google. And you find out that, oh my gosh, what's the rest of my life going to look like? Am I going to be able to play golf with my buddies? Am I going to be able to chase my grandkids around the park? And so on and so forth. Am I going to be able to lead an active, regular life? If you're a female of childbearing age and you want to have a family, am I going to be able to have children? If you're a breadwinner, am I going to be able to support my family and continue working? These are all very real questions that play on your mental health. So it's not just the clinical aspects of your PNH disease, it's the mental issues that you're now having to deal with. And the mental aspect is something that is really not recognized in a rare disease because of all the things I just mentioned. Besides having to live with the clinical aspects, you have to deal with things like shortness of breath. Patients have difficulty focusing. They have sleeping problems. They have headaches, and so on. So it's not just the clinical aspects. And even when you're on medications, which today we're lucky, I was diagnosed in 2001. There were no medications. Today, is a completely different world than it was 20 some odd years ago. But despite medications, patients still have all of these mental issues to deal with and all of these non-clinical symptoms to come to grips with, to have a normal life. We've come up with some policy recommendations, and I'd like to hand this over to Cindy, and she'll go through them with you. Thank you.
Thank you, Barry. Yes, the recommendations that we have come up with deal with 3 different areas that you see on this screen. First of all, the frequency and the severity of the symptoms have to be captured in each of the areas. And as Barry mentioned, the psychosocial area is often the one that is overlooked. The experts have looked into collecting the data and look at things such as fatigue. And fatigue is such a huge issue for PNH patients, and is so important to acknowledge this in all of those areas that we talked about, working, just having an active social life, all of those things that make up such an important part of people's lives. And the efforts to centralize that data is just going to help in the future to recognize all of the issues that these patients deal with and provide health authorities, provide pharmaceutical companies, provide healthcare professionals as to how to treat and work with PNH patients across the world. Next slide, please. One of the most important things I hear working with patients is, I wish I found your organization sooner. And as Barry said, often the first thing a person does when they hear they have a diagnosis is go to Dr. Google. One of the goals I know of both our organizations and indeed organizations worldwide is that patients are able to contact us at the very beginning so that they're getting good, solid information about PNH. One of the key things is that peer-to-peer support. There's nothing worse than having a diagnosis of something and not being able to find anybody else who has that diagnosis. And again, because PNH is such a rare disease, it's likely not even in the same clinic are they going to find another patient with this diagnosis. So I know with AMAC, we have a strong peer-to-peer support program. We can connect patients immediately with another patient. They can communicate by telephone, by email. And this buddy system or peer support system is such a valuable model for patients. The key thing is the patients finding out about the patient organizations. And one of the things that I know I work consistently with is raising awareness within the clinics to see the patient organizations as a key partner in the patient's journey. So that part for me is what I work on constantly, so that when a patient is diagnosed, they get the information about the patient organizations right at the start of their diagnosis, so that we can support them as they go through the journey that we've talked about today. Thank you.
Thank you very much indeed, Barry and Cindy, for your very compelling messages, which are also very practical, very tangible. If you were to identify one or two of the most frequent concerns or questions that the patients within your respective organizations ask, what would spontaneously come to mind?
I'll take that first. Am I going to be okay? Am I going to be able to live to a ripe old age? That is the biggest fear that patients come to me with. How about you, Cindy?
Yeah, I would agree. I think especially for younger patients, there's if the ability to work, the ability to sustain their family, those questions, come up, and I think that because it is such a rare disease, just getting the right information at the start, as I said, to answer some of those questions. But I think when a person is diagnosed with something, they want to know, is there anything I can take to cure this? Is there something that I can take to bring my life back to normal? And so, those are the questions that need to be answered by an organization like Barry's or ours, right at the onset of the diagnosis.
And if I can just add very quickly to something that Cindy said, how is the treatment schedule going to affect my ability to go to school? What do I tell my workmates? That I have to take off time, half day, a day, whatever. These are all compelling questions that patients have to deal with, especially at the beginning when they first get diagnosed.
Thank you both very, very much indeed. And thank you for bringing your testimony from Canada into Europe. Let's add another piece of the discussion and also have a possibility to hear from nurses, the nurses' perspective, which will be illustrated by Louise Arnold, who is a PNH specialist nurse at Leeds Teaching Hospital in the United Kingdom, and Michael Brown, PNH clinical nurse consultant at the Royal Melbourne Hospital in Australia. Thank you very much, both of you, for being with us, particularly again to Michael for the unacceptable, I suspect, time that you have to deal with in order to be with us. The floor is yours.
Thank you, Eduardo. It's and it's nothing a few toothpicks can't overcome holding my eyelids open, so it's all good. So thank you for the opportunity today. Louise and I are just going to briefly talk about the role of the nurse in the care and management of people affected by PNH, and briefly touch on some of the challenges and foreseen gaps in care, and like everyone else today, touch on the policy recommendations that have come about through this amazing project. Next slide, please. So what is the role of PNH nurses in the care of the person affected by PNH? Typically, we become involved following the diagnosis. We're actually a key link in the sharing of information to patients, who are heavily involved in the treatment administration of treatment, as well as the coordination of treatment, including blood product support and alike. We're often there as provide practical and emotional support to both the patients and their families. Therapy-specific learning is often historically, as Louise and I can very much attest to, has been on the job training, and dealing with people or living people living with PNH are also very knowledgeable from the links in with Dr. Google and their associated support associations, and leaving some nurses feeling somewhat disempowered within their role as care promoter, and frequently feel that they're unable to offer more to patients than is available. And I'll just hand over to Lou for the next couple of boxes.
Thank you, Michael. We're still on the same slide. Sorry. Thank you. I'm honoured to be part of this incredible event today, representing the nurses. I feel very humbled to follow Barry and Cindy. but excited for this consensus paper to unfold in the rare disease world. We have worked hard and have seen many discussions, but it's good to see this launch event today. To pick up on this slide from Michael, as part of a multidisciplinary team, nurses can be part of the patient pathway from the time diagnosis is made. And if, as Michael said, you're like us for decades afterwards, becoming part of the patient's life. The level of involvement varies with patient to patient at different times in their life. Different events happening, the involvement as a nurse can vary greatly. I've had patients over the years where you've spoken to them daily, to patients that you see just in clinic, and all of those are just as important, those interactions. We can have more involvement at big life events, such as if a patient has an acute onset of infection, upsetting the balance of the PNH picture, or if a lady's having a baby, to end of life care. To times when we aim for the PNH also to be just part of the individual's life and not focus of their life, just something that's there in the background. The aim is always to help someone not be diagnosed, not be defined by their diagnosis. Next slide, please. So, finishing off, sorry on the slide before, there is a relationship that can develop between patients and nurses. Sorry, I missed this bit off in my mind. Given an insight to daily concerns, especially the main concerns to the individual, like fatigue, a common unmet need, supporting the quality of life and aiming for the individual continue to do daily activities like work or study, has already been mentioned by Barry and Cindy, or looking after the family. This is so vital in supporting that alongside the way the patient group does. Our role as nurses comes into that aspect, as well as the care with the treatments and administrations. The relationship can give the nurse insight in how the burden of the disease can be constant. It's a lifelong diagnosis for most, and involving, as Morag said, lots of treatments, IVs and injections and supportive care. So it can be very involved at times. Moving on now to the gaps and challenges in the next slide. Where do we see these gaps and challenges? It's different in different countries. In the UK, we have a centralised care system in the PNH National Service with a shared care approach with local teams. We need to consider how experience can be shared. I've learned on the job, as Michael said, we've experienced or attending medical sessions that sometimes go way over our heads or aren't quite as practical as we need as nurses. So we do need targeted sessions, and now we have built more experience across parts of the world. Sharing this information and knowledge in education is surely vital. Thinking succession management, but alongside building some more robust PNH education. If education happens, it can be simple teaching sessions in emergencies currently, especially when a nurse has a new patient in their care. And the how and why needs consideration. In management of information and appropriate targeted learning, resources available and needed would be ideal. I'll hand over to Michael.
Sort of lack of knowledge in turn results in sort of a reduction in confidence in many nurses on that they're able to actually sort of manage these patients sort of to the best of their abilities. And it's often sort of not from the fault of the nurses, it's actually sort of just confidence is actually just built through clinical experience and exposure to managing these people through all of their life experiences. The contributing factors to this is besides the fact of PNH being an ultra rare disorder, is from a nursing perspective, there's sort of just competing sort of attention on their workloads. There's frequently high turnover and rotation of nurses within sort of the day procedure units of and especially within larger city hospitals, and there's competing attentions where the PNH patients are actually managed in shared care facilities like cancer facilities, as well as there's very much a competition, or not a competition, but sort of emphasis, prioritizing the care needs of people, for example, if they're affected by cancer, or in the centre that I'm attached to, that's other non-cancer related disorders like multiple sclerosis, Crohn's disease, etc. So next slide, please. So just leading on to the policy recommendations, as we've sort of highlighted, many people living with PNH are actually supported by PNH specialised nurses, and in the acute setting and unforeseen changes and challenges in their management can actually prove to be quite burdensome on the unspecialised nurse. To bring more value to patients and to the healthcare systems in general, we're actually recommending that a PNH specialisation program be established, to offer nurses the opportunity to actually develop their career, and as Louise suggested before, is actually as a form of succession planning for people like ourselves. A formal nurse training curriculum could be developed at a national or an international level that should ensure the consistency of care is managed wherever the patient's actually receiving their treatment. PNH nurses, speaking from personal experience, of course, and on behalf of Louise, are an extremely rare but also extremely valuable tool in the optimal management of the patient care experience. A national core network of PNH specialised nurses could help support the general haematology nurses in the care and management and also mentorship of these nurses, and especially helping them deal with difficult or out of the box type scenarios. And I'll just hand over to Lou for the last couple of points.
Thank you. So nurses play a vital role in linking the whole picture together in many ways. And I think with more understanding and knowledge, that can be easier for the nurse, but it also can be learnt as required, but with appropriate information available. And I think patients have that vital link as a special relationship in the sense of guiding things, but also as an information giver and having that open door kind of policy to somebody that may understand their rare disease that you may not have in the same way with less rare conditions. And those moments of speaking to someone when you take their bloods or giving therapy or being in clinic and available just creates such a setting that it may ease some of the burden, but that leaves a place for all of the different people that have spoken today in that picture, and we all work in a team towards that. I think increasing that knowledge in nursing would be vital going forward. Academies in nurses can complement each other with all the healthcare professionals working together, working in multidisciplinary as we do. We would like to see these support the vital role nurses play, giving them the knowledge and understanding to do this, and play the vital role they need in the multidisciplinary and nursing patients' life as a whole. The global consensus paper is an essential first step in maintaining best standards, care and management of PNH, irrespective of which country where they live in. And we thank you for your time today, and I will hand back to Eduardo.
Thank you both very much indeed. I can only repeat and echo what you both said, how vital it is to ensure that the role of nurses is maintained. In fact, all these proposals regarding specializations, the academies, a core nurse network are extremely valuable and extremely tangible to strengthen the role of nurses for the benefit of the PNH patients. Just a quick practical question, which has got to do actually with what would be needed, in your opinion, to establish an international core PNH nurse network, since building on what you have illustrated, the plan to have national networks may be probably and hopefully doable. What about an international network? Is it purely aspirational, or is it something?
Well, it's something we've worked towards over the years, and I think it's a difficult question to answer, if I'm honest. But I think in the modern world, and having more awareness and being able to do things virtually like this has made the world of difference. Fortunately for myself and Michael, we met at an investigator meeting for a clinical trial, but that has been a vital relationship all the way through. So I think it's just making those connections, whether it's with nurse advisory boards or general education sessions that bring nurses together. Off the back of that, you then develop connections which can be then sharing of information type connections. And if there's some education hub or thought, then you can build on it from there. I don't know if Michael would like to add to that.
I would absolutely agree, and I'm always of the adage, from little things big things grow. So, and sort of and yeah, I think like if we start off small and just slowly build, sort of it will come, but it's just trying to actually maintain that momentum can be quite challenging. So.
Well, and that's precisely what policy recommendations are for. So now the next phase will be to leverage these recommendations and make sure they are fully implemented around the world, in Europe and beyond, of course. Thank you very much again to both of you, Louise and Michael. And now I would turn to Dr. Emily Persson, who is the Head of Global Medical Affairs and Clinical Science at Sobi in Sweden. And the focus of Dr. Persson will be on the need to reduce inequalities and improve access to treatment. And of course, how important it is to ensure that there is a strong and sustainable ecosystem for research and innovation.
Thank you for that. Thank you. And I'm very, very happy to be here today. And I would like to thank my fellow panelists for some really nice presentations. And I think that in my presentation, I will also bring some of these points made in the previous presentations into this setting. So I would like today to just go very briefly a view on the evolution of PNH care and outcomes and what we need to change to improve the outcomes. And also, why do we need multi-stakeholder collaborations? Because I do think that this is really evident that is what we have here. We really do have a multi-stakeholder collaboration, and then end up with some policy recommendations from this perspective. So if you go to the first slide, I think we can all agree that there has been quite an evolution of PNH care and outcomes during the last decades. We should remember, though, that before 2007 and before the introduction of C5 inhibitors or complement inhibitors to treat this disease, this was a life-threatening disease. However, today, people living with PNH have a near to normal life expectancy compared to the general population. With that said, we also know that there are global discrepancies in terms of the outcomes and also in terms of the access to the treatments. Today, once we have established treatments that can actually change this from being a life-threatening disease to disease of a lifelong, or something that you can live with lifelong, we also have to raise the awareness of that there are still unmet medical needs in this patient group. As Dr. Griffin were alluding to, we have the extravascular hemolysis and the intravascular hemolysis that are still present in this patient's group, even though you have the ability to be treated with a C5 inhibitor. And there is a need, and we heard this with the education and the awareness in all of the different communities, the professional community, the patient community, and also the industry community, for continuous improvement in this. We do see today that the therapeutical benefits are improving. We can move away from treating just a life expectancy to go on to focus on quality of life and how that can implicate on your work productivity. And in order to drive this change, to continue to drive this change, we need multi-stakeholder collaboration. Today, the PNH community is beginning to set these new treatment goals. There are new treatments being developed, there are new treatments available, and these have the possibility to increase also quality of life in these patient groups. And what we're also starting to see is that we are setting these new treatment goals, is that we are considering the patients as individuals, where the treatments and the management is actually targeted to that individual's perspectives and wishes for life. And the target here would be that all patients living with PNH have a timely diagnosis, which we also heard a lot about, and an access to treatment according to their individual goals for life. And if you go to the next slide, in order to achieve this, both the timely diagnosis and also the access to treatment, we need to continue to train the community on the diseases, which also addresses the multiple clinical systems. And this is again going back to the presentation by Dr. Griffin, where you can see all of these different symptoms a PNH patient or a patient with PNH can experience throughout life. We also need to initiate the re-evaluation of the disease and specifically the treatment guidelines. And we can see in this slide that although there is a few guidelines that are updated, just recently updated, there's also several guidelines that are still not updated and which needs to be done. And I know that there are work ongoing on international guidelines, and these also needs to be implemented on a national level in order to actually assure that the patients get the treatment and the management of their disease that they are needing. You go to the next slide. So as I was saying, we're here today as a multi-stakeholder collaboration, which I really think is inspiring. And in order to address this, there's lots of different needs, both unmet medical needs, individual needs for people living with rare diseases such as PNH. We need this partnership with clinicians, researchers, both national and international institutions, and also the patients and also the pharmaceutical industry, which I'm obviously representing here. And here we need to collaborate on independent disease and treatment registries. These registries can be used to deepen their understanding on how to treat severe PNH patients, how to improve quality of life. In order to improve this and in order to learn more and utilize these tools, we need to agree and validate the use of new quality of life measurement frameworks. And of course, this is really a circle where the one thing leads to the another. The importance of collaborating, both of funding and implementing these disease and treatment registries are extremely important. And behind the policy recommendation that I will present on the next slide, we can look at some facts. Before the adoption of the European Orphan Medicinal Products and Pediatric Regulation, the OMP, people living with the rare disease could only access 8 different treatments. Today, this number is increasing. So currently we have 200 or more than 200 treatments, orphan treatments in Europe, which includes treatments also living with people with PNH. But also if we look outside Europe, we do see regional discrepancies, international discrepancies. For example, in a country like Canada, where we have representation here today, the length of time from the regulatory approval of the treatment to the actual reimbursement, making it possible for the patient to access the treatment, that varies significantly across the different Canadian provinces. Also in a country like Australia, that has a OMP adopted in 1997. However, there's also in healthcare, a challenging healthcare system when the financing system hinders the delivery of these treatments to the patients. So with those in mind, the policy recommendations, go to the next slide, is targeting to building a more resilient ecosystem for rare diseases for research and innovation. And if we want to ensure that, according to the UN resolution, no person living with a rare disease is left behind, we need to improve the rare disease regulations by building on past successes such as the OMP, and also leverage on examples from other countries outside the European Union. Also extremely important here is that we harness the full potential of real-world evidence and secondary data. Due to the nature of rare diseases being rare, the majority of these diseases today, or the interventions today, are based on single-arm trials. The approvals are based on single-arm trials that has a limited number of patients, because of course in a limited patient population, it's very difficult to do large randomized controlled trials. So in order to further inform the healthcare decisions and making sure that we get access to treatments, we need to increase the standards for real-world evidence to ensure the harmonized collection, to ensure that we use these data, and to ensure that we have a harmonized interpretation of the data. The European health data space can unleash a new path for research and innovations for people living with rare diseases, both ensuring that we can have national disease registries that are interoperable. And the goal of this would be to have a thoughtfully calibrated and predictable incentive framework, which would then constitute the foundation to continue to attract research and innovation into areas, the rare diseases that have limited or even no treatment options. I think it's important here, and I think we've seen that throughout the presentations today, that even though you can have one licensed orphan drug or one licensed treatment for a disease, it does not equate to the alleviation of all medical needs in that patient group. So both for current patient groups that we have treatment for, but also the ones that we don't have treatment for, we need to continuously innovate and do research in order to provide better quality of life for the patient groups. So thank you very much for your attention.
Thank you very much indeed, Emily. Also, one quick question for you regarding the future availability of new treatment options. How do you think, how close is it for the PNH community to reach the target of access to treatment according to individualized goals? That's a bit more specific than, you know, a general access question, but I think it's very, very important for the patient community.
Yes, thank you. That's a really good question. And it's actually almost two questions within that one. I think when you discuss access to treatments, we of course first need to make sure that in the countries where there is no access, we need to assure that we do have access. And of course, discussing this as a disease that can be life-threatening, that will be the first step, that you're making sure that you have access to those treatments. And that's work ongoing in many different regions in the world. The other part of the question that you asked was around the individualized treatment. And here I think we do, it's not just for PNH, it's for many diseases. It's not just for rare diseases. I think it's for as also common diseases. I think it's extremely important that we start, when we have the tools in our hands, it's important that we listen to the patient's goals, to the caregiver's goals, to see that what is it that you want. It can be convenience, it can be we were discussing, we heard earlier about how this affects, how often do I have to go to the hospital and all of those kind of things. So I think that you can tailor-make treatments towards individual patient needs when you have the possibility of several different treatment options.
Very clear. Thank you very much indeed, Emily, and thank you for joining and supporting this initiative. We are perfectly on time when it comes to the roundtable discussion and the illustration of the different perspectives that from a clinical standpoint, the nurses' standpoint, the patients, and the industry have been offered to the participants today. It's now time to turn to a Q&A session. So any open question, I would invite participants, please, to write them down in the Q&A button, or in the Q&A function, I should say, below the screen. And first, I would like to pick on the question that has been addressed to Michael and Louise regarding the possibility to establish a specialist nurse network with IPIG. Do you have any suggestions on this point?
Funny enough, it's something we've discussed ourselves recently, and have asked for it to be raised at the annual meeting, which is happening on Friday. We have tried that in the past many years ago, and it sort of made a bit of a ripple, but I think now in the current climate would be a very powerful way of doing that. Definitely.
Thanks. Great. That's very straightforward and very clear. Let me also introduce Olena Wagner, who represents PNH Ukraine, who is with us today, and who could also perhaps share her perspective on what are the most frequent questions that she has received from patients within her organization. Olena, are you with us? I believe she is, so.
Yes, hello, hi.
There you go.
Here I am.
Good afternoon
Yes.
to you. Thank you for joining.
Thank you. Thank you for giving me the floor. I actually prepared a good question as well, but in terms of responses that I have for your question, the patients that we see mostly reach out to us right after the diagnosis or when they fall significantly ill. And the first question I ask, what to do, where to go to look for help. And then when they realize that this will be lifelong and this will be something life-changing, for example, for many of them it means immigration or relocation, they start asking the questions about exactly that, how to rebuild your life with a new circumstances, with a diagnosis, with a new degree of vulnerability, and likely in a new place. So these are the most frequent questions. And even though they are very important questions from practical view, I think what's important for us as patient representatives, as patient veterans, to help people reach is exactly the understanding that disease does not define them. I think Isabel mentioned that before, and I liked it a lot, that what defines these people, Louise, yes, I think it was you who said it, right? It's a very, very deep thought. And I think this is something, that's the message that we should carry, that this is not what defines you, your diagnosis, in many forms. I hope I
100% support. Yeah.
Thank you, Olena. You also had put forward some questions, and I think there is one which seems also resonating with the points made by many speakers earlier in the conversation. The empowerment and the participation of patient representatives in decision-making processes, and in particular when it comes to health technology assessment. We all know that in various jurisdictions around the world, there are always lengthy discussions, legitimately so, regarding HTA assessments. However, it surely can be valuable, meaningful, and impactful to have the voice of patients systematically at the table. Any thoughts that Olena or anybody else can provide in this respect?
We are lucky here in Canada in that CADIF and INES, which do the HTA assessments, actually invite and welcome patient input into the process.
Thank you.
The one thing that I would add to Barry's comments is that, you know, organizations work together. For example, Barry and I have worked together to give input on behalf of our patients. So I think it's important, you know, if there are multiple groups in a country, that, you know, there is one voice, and you know, you have a strength with more patient data. So I think that's is very important.
Absolutely. Data. That's, I think, not the obsession, but certainly the ultimate goal that we all have in many therapeutic areas, in many disease areas. And that should be a clear objective and there should be a clear sense of direction in ensuring that as much valuable data is collected for the benefit of the patient community. If I go back for a second now to the previous speakers, one question to Dr. Griffin, if possible, Morag.
Of course.
There is also a sense that perhaps a reevaluation of treatment guidelines might be useful. And from your perspective, is it appropriate, and what is needed for the HCP community to initiate such a reevaluation process? Thank you.
So I think there's two caveats to that question. I think the first sort of indication for guidelines is whether patients need treatment, and I think that's a very good question, because not all patients with PNH need immediate treatment with complement inhibition. So an assessment of that and how that process occurs as well. So how do you assess a patient as to whether they need treatment, and then what treatment are you going to give them, and what treatment are you able to give them? So I think that's an initial treatment guideline, and I think that probably will not particularly change because the clinical situation is still the same. I think as a community, we're now in a very different position to where we were even five years ago in terms of how we reevaluate patients that are already established on treatment. And I think those are the guidelines that are more pertinent and more essential, and are currently not really written or available. So and I think for some centres who have a large number of patients with PNH, we discuss treatment measures and treatment outcomes and options to change patients from two different treatments, but that's often more complicated, and there's lots of parameters within that. And so I think clear and interpretable guidelines and practical guidelines, which we've already mentioned, for everybody to access need to be written. There is a plan by the International PNH Interest Group to take this move this forward as well. And so I would hope within the next year or so there will be some clear guidelines for that situation.
That's very helpful. Thank you, Morag. There is a question in the Q&A segment which refers to the development and licensing of biosimilars. Is this the question which perhaps Emily can start addressing? Clearly, there is a lot of research going on, and there should continue to be. What's your sense about the availability of biosimilars and the ability for clinicians and patients to be aware of them and also be able to prescribe them?
Thank you so much. And I do think that this it's just, I mean, we do have biosimilars on the way in, as in PNH, as we see in many other therapeutic areas. I do think that if we look through a life cycle of a drug, I think it's extremely important that we have this. We continue to innovate, we continue to develop, and as the life cycle kind of goes on, the introduction for society of biosimilars is extremely important. Also to work, as we were discussing earlier, there will be different access in different countries to different pharmaceuticals. And with the introduction of these biosimilars, we can really help to increasing that access. I think it's extremely important also to remember that without innovative treatments, there are no biosimilars, and without the continuous innovation and research, we would also not get new treatments. So I do think that we need, I think it's a good balance that we have innovative treatments, we have the continuous research, and then we also have biosimilars entering the markets.
That's a very fair illustration of the situation, and I think that's absolutely what creates headroom for innovation. In fact, the ability to also rely on biosimilars and their wider accessibility in different parts of the world, if we exclude, you know, the wealthiest part of the world, by the way. Let me touch again for a moment on the nursing role, because you have alluded to the fact that we have to ensure that the knowledge, the experience from treating PNH patients is not lost when nurses rotate from different units. Now, this is obviously for primarily, at least for Louise and Michael. How do you see this happening? How can we ensure that the capital, the human capital, the know-how and the experience are maintained?
Let Michael go first.
Oh, okay. No, I was trying to be a gentleman there. Sorry. No, I think it's sort of, I know how I try to currently practice is actually just a constant sharing of information within my collegial group, and sort of I think the tricky part of it is actually trying to actually sort of broaden that out beyond sort of whether it is actually through connections within IP or sort of within sort of a country like Australia that's sort of your population's quite dispersed, as well as actually trying to actually sort of establish sort of national groups. But sort of it's sort of and sort of I think things that I've been working on locally as well as been sort of setting up sort of almost internet-based education sessions, and sort of that can be referenced by sort of anyone with the appropriate access. Sort of, but I'll hand back over to Lou. So.
I didn't want to interrupt you, Michael, but you've knocked your camera off as well, so we lost your face. I think, you know, echo the very similar thing. You do something very locally and educate the staff that come along into the unit, but we also work on a national level and increase information that way. I think it's having something that's accessible at a time that it's needed often, and it's so vital. We're building on that as a national service and doing education and information giving from that point of view, working alongside the patient groups in the country here, and obviously spreading that as much as we can internationally. But it's being invited to speak alongside the medics and being included in that education kind of sphere of sessions that do happen at less accessible for nurses at time. And I think if it's recorded in the modern world, someone can access it at a time they're able to use it and build on it that way. It would be a nice thing to see.
And apologies, my camera has actually decided to not work at sort of 1:20 in the morning.
Well, that's understandable. Also, cameras have their rights.
Yes.
There is another good point in the Q&A which has got to do with ERNs. Are you all familiar with the European reference networks? In particular, there is an ERN called EuroBloodNet, which I assume the PNH Global Alliance is part of, and clearly the role and the objectives of the ERN, particularly EuroBloodNet, are extremely important to the cause of PNH patients. Are you perhaps able to say a few words on whether you've had an experience with EuroBloodNet and what is, from your perspective, what can be done in order to strengthen the European reference networks, which appear to be a very successful policy initiative implemented in Europe in the past several years for rare diseases? I don't know if Emily or Morag, you have any thoughts?
Yeah, I'll maybe go first. They're also a very valuable organisation, and they've been running a lecture programme on PNH and bone marrow failure, which has been a 1-hour sort of segment for healthcare professionals, but patients can also access these as well, depending on their sort of understanding in patient sort of level in patient group. So I've certainly done a couple of lectures for them, and they're easy to access, and they're sort of 1-hour sessions. So that's part of a wider educational programme. So yes, we are, as a service, sort of feeding into that, and I think Louise had done a couple of lectures as well as part of that service. So, but yes, as a wider organisation, they're very interactive and helpful, and reach out to various people as well.
Thank you.
And maybe if I can build on Morag's answer, in addition to the fact that they are very well networked, so obviously they have the healthcare professionals networks and also the patient organizations. I think a key aspect is how do we ensure that they continue to have funding? And I think that's why the European Commission, who is the main funder of these ERNs, has very much discussed models, to ensure that they continue to exist and that their work is valuable. I think some of the aspects that can definitely help is how do you establish these interoperable registries, and how do you establish the guidelines? Because we have so many ERNs, and obviously we have international registries as well. So I think what they can help is establishing guidelines and establishing frameworks for how these registers are set up in the future. And obviously just continuing to support and provide educational materials and staying up to date. So we've actually invited them to be part of this initiative, and they're very much there. And we very much hope to collaborate also with them in the future. And hopefully maybe as we are doing the next event in the European Parliament, because they are in Brussels. So obviously we would like to have them as well there at the next event we're doing.
Thank you, Michaela. And that's definitely one of the deliverables for partnering for PNH, I suppose. I do not want to forget that Olena had raised her hand. Perhaps, Olena, you had some thoughts to share with the team, with the group?
Yes, thank you. Thank you, Eduardo. I wanted to continue a little bit the topic that we touched upon before, which is biosimilars and access, but also one of the way to ensure access in countries, access to treatment, to new treatments, innovations in countries where there is no access to treatment and maybe no will to reimburse or make those treatments available. Maybe licensing out the innovative treatment could be a solution. So I wanted to check whether the industry looks in that direction, whether it's something that is being discussed, the licensing, the voluntary licensing for production at differential prices, maybe for those countries that cannot afford or for any other reason cannot access the available effective treatments of PNH.
Thank you, Olena. That's a very important point, which is certainly being discussed at global level through various international organizations. I'm sure you're familiar also with the deliberations that in recent years, the WHO and other multilateral organizations have been having with regard to several specific therapies that should be accessible and affordable in different parts of the world. So I am sure that also your call for accessibility and affordability through different solutions, such as licensing, etc., will be heard, and are part of these ongoing discussion, which is absolutely critical for patients around the world. I would like now to pause for a second and thank all the experts, all the panelists who have contributed to the discussion today. We are getting close to the hour, and we are also fortunate to have with us MEP Mr. Stelios Kympouropoulos, who would also like to share his thoughts regarding this initiative in particular and the policies that the European Parliament is working on with regard to rare diseases. Again, I have to underscore the fact that it is thanks to members of Parliament and policymakers like Mr. Kympouropoulos that we can see progress in health policy issues, particularly rare disease policies across Europe and beyond. So let me invite Mr. Kympouropoulos to, oh, I can see you now. Thank you.
Yes, of course.
Thank you very much indeed for
Do you hear me?
with us. Good afternoon, and please, the floor is yours. Welcome.
Thank you very much, Mr. Pisani, for your kind words, and I'm very happy to be with you today, sharing some thoughts regarding PNH initiative, but also the issues as far as rare diseases. And as a member of the European Parliament, and in my role as a political coach of partnering for PNH, as well as a physician and a member of this Parliament, European Parliament, I have dedicated more than a decade to the challenges faced by people living with a rare disease, and I'm pleased that I can also offer my support to people living with PNH. This initiative shows us how heterogeneous the needs of people living with PNH are, and how hard it is to find solutions to address them. It is really a lifelong struggle, and policymakers need to understand these struggles in order to enact patient-focused policies. Research around PNH has made headway in the last decade, encouraged by regulations in Europe and around the world. This supported the development of new treatments which improved life expectancy to near normal, and now can improve the quality of life for people living with this condition. And you know very well how high are my concerns regarding the issue of quality of life. However, as we have heard today from the expert group, PNH still has negative socio-economic impacts on patients and their caregivers throughout their whole life. It is clear, for instance, that the lack of awareness and understanding of this particular disease means that challenges for those living with it start already at diagnosis and persist throughout their whole disease experience. The faster these patients can receive a diagnosis, the higher are their chances to improve their outcomes. Improving awareness on all symptoms is key to making sure that the PNH patient journey is safer and that healthcare professionals are given the appropriate tools to support their patients. It is also essential that with increased awareness also comes expedited access to the appropriate treatments. For people with rare diseases, health authorities also need to consider the indirect costs or non-health related benefits of new therapies, such as the ability to return to work. Furthermore, the partnering for PNH experts have shown that a more personalized understanding of PNH can lead to considerable benefits for individual patients. The frequency and severity of persistent symptoms, such as severe fatigue, which is so heterogeneous from patient to patient, should be captured from a physical, psychological, functional, and social perspective with PNH-specific patient report outcomes measurements. It is also great to see the existing best practices that, if made more widely available across different geographies, could improve the patient experience. I believe, for instance, that by further empowering and including patients and caregivers in decision-making, we can move towards a system of care that is patient-centric. The same goes for specialist PNH nurses, who play a crucial role in patient care and deserve a stronger voice to bring value to patients and healthcare systems. I'm certain of one thing. As the outcomes and proposal of partnering PNH see daylight, we have reasons to be optimistic. The time is right for the solutions proposed by the expert group to be implemented. Policy frameworks are changing around the world, and in Europe so far. And for it, I would like to thank you for this initiative and to give the voice on patients with PNH to raise their issues and to help healthcare professionals to understand and social perspective to understand what is going on and what are the issues that will need to be solved in order to have their life in equality and in a better living conditions. Thank you very much, and I hope to have a voice and to raise this kind of awareness that is needed by the society. Thank you for the attention.
Thank you very much. Your voice is extremely important and valuable, and your commitment is always felt. And therefore, on behalf of this group partnering for PNH, I would like to thank you for being part of this conversation today. I also share the optimism that you have indicated in your words, in the sense that there are solutions which have been offered by all the experts who have contributed to the discussion today from Europe and beyond, in fact, from many very different continents of the planet. And these solutions will be captured in a report, in a consensus policy paper that will be shared after this event. So once again, thank you first and foremost, Mr. Kympouropoulos, and good luck for the work to be done in Parliament on this matter and for all rare disease patients. And let me close this meeting today by thanking all of you who have very actively contributed to the discussion and helped shedding light on PNH, which is, I suppose, the mission of Partnering for PNH as a coalition. And I am sure it will continue to be visible, to be helpful to the patient community for the years to come. Thank you all very much and have a good evening, or a good night in the case of Melbourne, Australia. Bye.